Hi everyone, I am Aspen. I chose to do my final project on managing polycystic ovarian syndrome, also known as PCOS. I chose this topic because a few years ago I was diagnosed with PCOS, and after seeing many doctors like a gynecologist to regulate my cycle, a nutritionist to help with better eating habits, and a dermatologist for my skin, I am no closer to a good solid plan to help manage my symptoms than I was in the beginning. Even though I see all these doctors, it's my family doctor who runs the blood work and never discuss the results with these other doctors, so I am left to navigate what to do and who I should see for my individual symptoms. This topic has been on my mind lately because soon it will be time for me to have my own children, and I'm nervous about infertility, passing PCOS to my children, and just hoping I have made all of the right decisions in the process of learning to manage PCOS. During this presentation, I will explain why this complex problem for many women who have been diagnosed with this disorder and offer some possible solutions on how to help. For those of you who know about PCOS, or if you have never heard of it, I hope you enjoy my presentation and are able to learn something new. Polycystic ovarian syndrome, also known as PCOS, is an endocrine disorder that affects many women in their childbearing years. According to Merriam-Webster, an endocrine disorder occurs when an endocrine gland makes too many or too few hormones. PCOS can be a little tricky for patients and doctors. What causes PCOS is not exactly clear, although there are many factors to consider when signs and symptoms are present. Some of these things include genetics. So if a woman's mother or sister has PCOS, you have a better chance of also being diagnosed during your reproductive age. Insulin resistance. This means someone may be less sensitive to insulin than what is considered normal. They also may produce many male hormones. Obesity or excessive weight gain is another factor that has been linked to PCOS. You will also notice throughout this presentation that some of the things I mentioned, like obesity, for example, are listed as possible causes and possible symptoms, so that can make managing this aspect of the diagnosis very difficult because is obesity causing PCOS or is weight gain because of PCOS? Many women are affected by PCOS. This chart shows a percentage of women who are diagnosed. It is important to remember that some women go undiagnosed because of lack of knowledge or lack of health care. Age is not a factor when it comes to PCOS diagnosis. PCOS does not discriminate against race or ethnicity. Many times, symptoms of PCOS go undiagnosed until there is an issue or the symptoms become bothersome. Unfortunately, early diagnosis is uncommon, but can help manage symptoms because they are becoming more of a serious problem. Some symptoms include irregular menstrual cycle, obesity, too many male hormones like testosterone, excessive hair growth, acne, alopecia, and infertility. Managing the symptoms of PCOS can be difficult for a few reasons. Like I mentioned earlier, the exact cause of PCOS is unclear. This can make it harder to diagnose, and early detection is key to managing a diagnosis. Symptoms vary from patient to patient. This means PCOS is not going to look the same for every patient. Some women struggle with weight, which can lead to other long-term conditions like diabetes and heart disease. Some women have missed or non-existent periods, which can lead to difficulties getting pregnant or even infertility. There are many other symptoms of PCOS, and women can have one symptom or all of them. There is not one doctor that treats every symptom of PCOS, so managing PCOS can mean seeing many different doctors, and unfortunately, this can still lead to a patient feeling confused and unsure about what to do. Managing the symptoms of PCOS can be difficult. The list of doctors that women must see can also be hard to manage. Most of the specialists will focus specifically on the symptoms that they're treating and will not consider the advice of the other doctors. Without one doctor in charge of managing a patient's symptoms, a patient can feel like they do not know where to start and never have a clear plan for managing all of their symptoms. Doctors in medicine can also be very expensive, so this can also leave some patients without healthcare, left with untreated symptoms and very little education on the topic. In addition to medicines that may be prescribed for a patient, lifestyle modification targeting weight should be an internal treatment step for overweight or obese women with PCOS. Although there's no proof that one diet is better than the other, or even that certain exercises are better in managing PCOS, committing to a lifestyle change will help. Some suggestions for this are limiting processed foods, eating more whole grain, eating more fruits and vegetables, maintaining a healthy weight, daily exercise. This can be difficult for patients that do not have access to nutritious foods and can make PCOS seem impossible to manage. We can start by educating everyone. PCOS is the #1 cause of infertility in women. This can be hard on both men and women when it's time to start a family. So PCOS can quickly become a diagnosis for not only women, but for also men. Early diagnosis is a key factor in treatment. PCOS should be addressed by the doctor during yearly wellness visits for young girls entering the reproductive age, so parents and girls are aware of the signs and symptoms of PCOS. Society should also demand better treatment, more awareness, and easy access when it comes to women's health. There also needs to be access to more nutritious food choices in areas that might not have access to fresh fruits and vegetables. A mobile grocery store in these areas would help women with PCOS get the nutrients they need. People can also donate to the many organizations that research PCOS and help spread awareness. Here are a few organizations that people can donate to if they want to help. PCOS Awareness Association, PCOS Relief, PCOS Challenge. All of these organizations really do a great job spreading the awareness of PCOS. Thank you everyone for watching my presentation. I hope you enjoyed it.